Hey, I don't know if I'm comfortable doing a cranial nerve exam. I haven't done one yet.
Yes, well, the doctor is currently with a patient and it's running a little longer than usual. I peeked in and he seems to be very closely examining their ears. Kind of won't stop.
Okay. Is there instructions, something I can just follow?
There's paperwork in there for you.
It's in the room. Okay.
You're gonna do fine.
I can't promise this is gonna go well.
All you do is you're gonna do fine. It's gonna be great. Yes, great. Repeat
Alright.
great. Say the word great several times.
Okay. I'm going in. I'm gonna do it. I'm gonna do great. I'm confident. I am calm. This is gonna be great. Okay. Well, she had it wrong. It's actually my second time. It's you again. Weren't you just here a couple of days ago? Yeah. But now everything's echoing and like a wash and some kind of a reverb. Huh, that's weird. Well, I haven't memorized the instructions to the cranial nerve exam yet, so I'm going to turn around and grab it now. We're going to get cracking, okay? Well, good to see you again. Go through the whole process all over again, I guess. The instructions on how to conduct a cranial nerve exam right here. So we're gonna do this together. I don't have a cotton ball. I don't have a safety pin either. I do have some lights. Okay, tuning fork. I've got something that might work for that. All right, we're just gonna dive right into this and maybe learn a little bit together. Okay. So we're going to start here first with the olfactory nerve, and I'm going to read to you a little bit, and then we're going to do the testing, okay? So the olfactory nerve is the sensory nerve, and damage in the nasal epithelium, or the basal ganglion, might impair the ability to discriminate different smells. The olfactory nerve can be tested using products with specific spices so the patient can recognize the differences. However, usually just asking the patient, do you recognize different aromas, is enough. Well, it's not enough for me, I'll tell you that much, because I have some things you can smell over here. Okay, I'm going to grab them and we're going to do some smelling, okay? Now, these are maybe a little, they're more like a feeling than a smell. There's one that's kind of maybe a very specific smell. Okay, so we'll start with a specific one, and then we're gonna just think about how it makes you feel when you smell it, okay? So let's start with this one here. These are essential oils. Oh, that one does smell really good. Okay, so go ahead and smell that one for me. There we go. Do you have an idea of what maybe that one smells like? Close. It is kind of a tree smell. Northern white, black, spruce. Actually, is what that one is. And that one just, you get a whiff of that, it just almost takes you to Christmas. That's great. Okay. But good, you detected the tree. Okay, now these are more like feelings. I'm not really sure why these are in a doctor's office, but we're gonna start with this one right here. Okay, I'm gonna get a whiff of it first. Maybe. Right smell. Okay. Now, what do you think that smell is again? Maybe like a feeling or a concept. Not quite. That one's longevity. Like kind of peppery. Picking up some pepper in that one. I'm not sure how that's longevity. Maybe you think peppery hair. Get old. Okay. Now let's see here. We got two more. Here, oh, that's a nice one. Okay, go ahead. And what are you picking up from that one? Yeah, I was picking up lavender as well. However, this one's grounding. It's called grounding. Now, I suppose that's more of like take a moment and ground yourself, and not like you just grounded your children. Now let's go ahead, and this one, maybe, how does this one inspire? Ooh, that's a real good one. And what are you getting from that? I gotta smell that one again. I passed this test, by the way, because these all smell different to me. Christmas tree lot, right? Have you been to a Christmas tree lot? And it's just that overwhelming smell of Christmas tree. This one's called Believe. Did you get Believe from that one? No, but that smells great. Wow. You were picking up different aromas. And again, that was a little weird because they were all more like conceptual. So you passed that one. Congratulations. We're going to move number 2 here, the optic nerve. In this abbreviated exam, we will test only reflex responses for direct and concentric reflex. What the heck am I trying to say here? For direct and concentric reflex, my goodness, to bright light. This is done by shining the pen towards, I got that, into one eye and checking the pupils on both sides. If they constrict. This should be tested on both sides of common abnormalities, including neuritis, glaucoma, autoimmune conditions. I'm gonna shine some lights in your face, okay? We're gonna start with a big boy. Well, depends on who you talk to. It's not like I need to defend my house, big boy, or like I need to road rage, big boy. But it's just a good sized torch here. So let's go ahead and I'll get to the eye cover eye eventually here. I'll go ahead and cover half your eye at some point. But for right now, let's go ahead and you can look at the light. Okay, so look at it. Sometimes, you say, don't look at that light. But you can look at this one. Let's go ahead and follow it across the screen. There we are. And we're going to go back this way. Follow that across the screen. You're doing great. Great. Okay, eyes are looking good too. Let's go ahead and go top to bottom. Alright, and we'll go bottom to top. There we go. And we'll do that again. Alright, let's go. Alright, now I'm going to go around the perimeter. I'm going to come in until I'm on the edge. Go up and around. There we are. Down. We're just going around the very edges of what you can see. There we go. Let's go back the other way. Towards the bottom here. We'll work our way up. We'll work our way across the top here. And down. Nice. Okay, now check this out. Wide, sharp, wide. Okay. Isn't that nice? A little less intense maybe if we do it that way. Just keep following the light. And if this hypnotizes you, that's fine. I might ask you to do some funny stuff. Maybe I won't. Because I'm a pro doctor. This is a pro doctor. I'm not a student, that's for sure. Definitely not here while I'm also at university. First year. Okay. And let's go ahead and checking your pupils there, not having fun. That was not for my own benefit. Having a good time, that was to look at your pupils. Now, I'm going to go ahead and get a closer look at your eyeballs here. Let's go ahead and cover up half of your face there. Okay. Pupils are dilating. Great. Yeah, you're good over here. Let's go ahead and this side. Also doing pretty good. Okay. I'll go ahead and do that one more time. Let your pupils kind of dilate, then come back to where we are with the room. go. Okay, your pupils are looking. Now, I do want to try both eyes at the same time. We'll see how this goes here. Okay, are you ready? Okay, here we go. Both eyes. Ready and go. Nice. Okay. Yeah. Looking good. Okay, I'm gonna get real close in there. Let's go there. Okay. Wow. Yeah. You're looking great. There we go. All right, backing up. And keep an eye on the lights, both of them. Can you do that? Is that a challenge for you? Keep an eye on both lights. It's a challenge to aim these at your eyeballs. You want to do this? Okay, and there we go. Good news, your eyes look great. Your optic nerve. That's what it's called. It's looking fine. Now we're going to go ahead and do your oculomotor, trochlear, and abducent nerves, abducent nerves. These three nerves are tested together as a control movement of the eye. This is done by... Okay. So I'm going to... you're going to follow my fingers. Sounds good to me. Okay. We kind of already did like a follow the thing, but we didn't do a follow the finger, so I gotta follow the rules, right? So go ahead and look at this finger and just follow it along. There you go. There we go. Up and down. Keep following it. Follow that finger. Okay. There we go. Yeah, your eyes look like they're gonna pass this. Flying colors. There we go. Yeah. You're great. Those nerves are fine. Now we're going to try the trigeminal nerve. Ask them to clench their teeth while observing and feeling the movement of their muscles. I'm going to touch your face, if that's okay. So go ahead, and I'm going to need you to, flex your face, if you don't mind. If you were like, oh, but your face. Can you do that for me? And I'm just going to, it's a hair, don't mind that. Is the word palpate? I'm just gonna lightly touch your face, okay? So go ahead, clench your teeth for me, kind of like that. There we go. And I'm just going to lightly. There we go. Let me just feel these muscles. Now, granted, you are the first person I've done this with. I'm gonna check your cheeks here. And over time, I think I'll get a lot more experience with what's good, what's not good. So you're kind of a baseline for me right now. And you do feel like you're probably pretty healthy. But, I'm not going to be able to right off the bat tell you, your face is okay. I'm going to have to get an opinion from the doctor when he's done looking at the person's ears. He's weird. Okay. He does know stuff. Okay. Okay, I think you're alright. Let's see here. I'm going to read here for you. The 8 muscles which the trigeminal motor nerve innervates are the masseter or temporalis, the medial pterygoid, the lateral pterygoid, the myeloid, the tensor tympani, the tensor valeatine, and the anterior belly of digastric. And I think I felt all of those, and they felt good to me. Your face is fine. All right, moving on, we have the trigeminal nerve. Sensory. So did we just do the trigeminal nerve? Trigeminal nerve. Oh, that was the motor function. Now we're doing the sensory function. Okay. The trigeminal nerve provides a sensory stimuli to the face and mouth. It has 3 sensory branches: ophthalmic, maxillary, and mandibular. And it is tested by lightly touching the face with a piece of cotton wool, followed by a blunt pen in each division of each side of the face. Great. I don't have cotton. That's gonna be a problem. but I do have is that going to be blunt enough? Let's do, well, you know what I got right here? Here we go. I've got a cotton swab. It's cotton. It's not a cotton ball, but that'll do. And the end of this, which is kind of a circular, I don't think this belongs in a doctor's office, but tip of that should be okay. So I'm going to get, again, pretty close to your face here, and I'm just going to touch your face. There we go. And then we'll poke. And I'll touch. And a little poke. And a little touch. Poke. There we go. You can feel each one individually. You okay with this? Good. I mean, like I said, you do feel. It does seem like you're a pretty healthy person. Go. And tap. And touch. And tap. And touch. And tap. There we go. You felt all that? You could feel the difference between the softer cotton and the more blunt, cold, whatever this is? A file? Why is there a file in here? Your trigeminal nerve seems fine. Both the sensory and the motor, I think, are good. Okay, now we're going to move on to the facial motor nerve. The facial motor nerve supplies motor branches to the muscles of facial expression. The nerve is therefore tested by asking the patient to crease up their forehead by raising their eyebrows, not just yet, closing their eyes, and keeping them closed against resistance, puff out their cheeks, and reveal their teeth. Yeah, this one's going to be fun, because you're going to look like a total goober. Alright, so go ahead, and, okay, great. Now I'm going to need you to close your eyes, and keep them closed. Puff out your cheeks and then reveal your teeth. I'm going to show you what this looks like. So we're going to do that. Close your eyes. Puff your cheeks. And then reveal your teeth. Okay? Maybe, I don't know if you do that all at once. Kind of like I just did. But whatever, just do it. Okay. And your teeth. There we go. You could do all of that, so I guess you're good. Okay, here we go. Taste. Okay, we're going to move to the vestibulocochlear nerve. The vestibulocochlear nerve provides innervation to the hearing apparatus of the ear and can be used to differentiate conductive and sensory neural hearing loss using the Rhine and Weber tests. I haven't learned about these yet in school. Okay, so we're going to do a little tuning fork action here. And we're going to place the tuning fork on the mastoid process and the next thing here. Okay, here we go. We're going to, again, I don't have a tuning fork, but I've always noticed that my water bottle here, this Hydro Flask, has a really nice resonant tone. So what we're going to do is I'm just going to hold this up, I'm going to knock it and bring it close to the side of your ear, okay? And I just want to tell me if you hear it. We're going to do it 2 times. You need to tell me which one's louder, okay? We're going to do that in both ears, okay? So we're going to start on this side of your head. Okay, here we go. Ready? You're going to knock. Okay, I'm going to do that one more time. And which of those was the louder one? Yeah, the second one. Slightly louder, just because I hit it a little harder. Okay, we're going to go ahead and do this here. Now, am I going to flip the script on you? Is the first one going to be louder and the second quieter? Let's find out. All right. Go ahead and do this here now. Okay, here we go. And here comes the second one. Okay, and you could hear that, correct? Excellent. And the first one was the louder one. Yeah, okay. It's kind of hard it's really only louder right at first. Honestly, I think all four of those are pretty close to the same volume. But, you got the first one right. I kind of just told you what the second one was there. That's my bad. Let's go ahead and move on to the glossopharyngeal nerve. This one provides sensory supply to the palate. It can be tested with the gag reflex by touching the pharynx with a tongue depressor or by touching the arches of the pharynx. Okay, here we go. I'm going to please open your mouth. Okay, and actually, I should probably put on gloves. It'd be pretty nasty if I just stuck that right in your mouth. I washed my hands before I came in here because I'm a doctor. And if we're not eating, if we're not sleeping, if we're not with our patients, we're washing our hands. Okay, let's go ahead and get this one on. And there we go. Can you please open your mouth for me? I'm going to press your tongue a little bit with this. Okay, here we go. And, okay. I'm just going to tickle your pharynx here. Oh, tickle. Okay. One more time. For science. Open a little. There we go. Great. Okay. Excellent. Yeah, looks good to me. I guess. Okay. Can you do me a favor? And you usually take this, put it in your mouth. Or just put it in your mouth like that. And just hold it there for me for a minute. Now, can you please? There we go. Perfect. Now stick your tongue as far into there as you can. Alright, I'm going to poke it with the sharp end of the stick. And tell me when you feel it. Okay, cool. Yeah, I'm gonna be honest with you, I just made that one. Sometimes it's fun to see what you can get away with when you're a doctor. Up next is the vagus nerve. The vagus nerve provides motor supply to the pharynx. To test the vagus nerve, ask the patient to say, ah, which will cause the pharynx to elevate and observe the position of the uvula. When the palatal muscles works properly, the ah sound should clear and the uvula should not move side to side. So go ahead and say ah for me. Hang on a second. Okay. Say one more time. Oh. There you go. Alright, yeah. The uvula looks great. I'm going to just take these off now. I don't think I need to stick my hand in your mouth anymore. I'm going to go ahead and just remove those. That's easier to turn pages. Okay, so let's see here. What's up next? We have the accessory nerve. The accessory nerve gives motor supply to the sternocleidomastoid and trapezius. Ask the patient to shrug their shoulders, just shrug your shoulders forward, and turn their head against resistance. Okay, the common abnormalities include lower motor neuron lesions, which produce weakness of both muscles on the same side, upper motor neuron lesions, which produce ipsilateral sternocleidomastoid weakness, and contralateral trapezius weakness because of diffusing sources of cerebral innervation. Oh, do I really want to be a doctor? I am a doctor. I'm studying to be a doctor. Do I really want to? So what I'm going to do is going to do a little something here, and just that was I was testing your fight or flight response, and you had a pretty good reaction to that one. That was like a very good like, excuse me, what reaction? I'm not actually gonna do anything with this. Yeah. Why is this in here? Look at this. Why is this in here? What is going on? This is not a joke. Look at the size of this thing. That's like a real thing. It's got a sheath. Why is this in here? They put it out like. What am I supposed to do with this? Poke your face? Do you feel this? That's very concerning. One other thing in here. Sorry, we'll do the shoulder shrugging in here. They found it. I'm currently reading this book, and it's like it's just a really old book in 3 parts. It's not a trilogy. It's just falling apart. But they put it on the table like I'm supposed to do something with it. What am I supposed to do with it other than like, you smell it? Is it a sensory thing? It smells like an old book. It's a nice smell. I like the blue. It's a good book too. The Spy Who Came from the Cold. I'm almost done with it. Really, really good spy novel. That's, I mean, your ears work. Does that sound nice? It sounds nice to me, I guess. Okay. Alright, give me a shoulder shrug. One other thing in here I'm kind of puzzling over, but okay. I'm gonna give you a little resistance on the side of your head here. No. Shrug your shoulders. Go ahead and move your head over this way. Okay. Alright. No struggles there? That was good. Okay. Alright, I'm gonna go ahead and get a little resistance on this side as well. Shrug your shoulders. And tilt your head. Alright. Was that difficult for you at all? No? Okay, you passed the test. Congratulations. Let's see here. Now we're going to test the hypoglossal nerve. The hypoglossal nerve provides motor function to the muscles of the tongue. Check for vesiculation at rest and ask the patient to stick their tongue out. If the tongue deviates to either side, it suggests weakening of the muscles on that side, or you're slowly becoming a dog. Okay, go ahead and just stick out your tongue, please. Yep, looks good. Alright. I think that's it. I think we did all the nerves. I think you're technically done. You passed the test. Congratulations. Yeah. That's not too hard. I can see myself doing more of those. Now, I do... What was it? There was a couple of things. Why did they give me this? Why is this in my pocket? Somebody put it here without my permission. They just kind of stuck it in my pocket. Oh, good sound though. Okay. Last thing is another mystery. There's a bowl of water over here. A dropper in my pocket. What is? I'm not sure what the deal is with this, but I'm doing this because I think I'm supposed to do something with this, and I need to make sure I do everything the doctor wants me to do. I'm gonna grab this bowl here. Maybe just drop some water in it, and tell me if it's a good sound, okay? Okay, go to this ear, over here. Does that do anything for you? Okay, come over here and Did that do anything for you? No? Okay, well, I'm going to go ahead and do Oh, both sides of me here. You know, I don't know what this is testing necessarily, but got a little carried away there. Kind of fun. Okay. Well, I mean, that does it. I think, yeah, that's everything. I think I got everything that I'm supposed to do. Thanks for coming, and, you know, if you want to have another one of these, maybe the actual doctor will be able to get you in. I'd be happy to do it again sometime. Yeah, I'll see you when I see you, I guess, right?